Where I'd like to invite our chairpersons. Please welcome in the order of appearance Dr. N. Pratap Kumar, the course director, ijcto 2019 and chairman and managing director, chief interventional cardiologist at the Mediterranean group of hospitals based in Kollam, Kerala and Pan-India. Dr. Yuji Oikawa, senior consultant interventional cardiologist at the Toyohashi Heart Center, Toyohashi, Aichi, Japan. And Dr. Raman Chawla, Chairman and Chief Cardiologist at CareMax Super Specialty Hospital from Jalandhar in Punjab. I'd request Dr. Pratap Kumar to please initialize the proceedings. All our speakers will have 12 minutes, 10 minutes for presentation and 2 minutes for discussion. Yeah, Dr. Oikawa has just joined. Please join us. Thank you. Yeah.
After the first session actually of basics, and we are just going to the tools and hardwares in CTO session. The first talk will be by Dr. Asakura will be giving the talk on the CTO wires.
Thank you, Chairman. It's my great pleasure to be here. Today, I would like to talk about CTO wires. Pathological study reported that CTO segment sometimes has microchannels. So most of the time, in this case, we can see some microchannels. In such a case, we often use filter XTR. As you can see, this wire can negotiate this very tortuous and tiny microchannel. In this case, proximal RCA is totally occluded. Of course, my first choice is filter XTR. In this situation, I just rotate this wire. We should never push this wire. This wire can be advanced automatically. Very fortunately, this wire can negotiate the occluded segment like this. Okay. And this is a final result about this case. The pathological study also reported that the size of the microchannel is almost around 200 micro. So for this kind of channel, 40,000 wire is too big. So tapered wire is sometimes very helpful. In Japan, we have Wizard series except for XTR. Wizard 78 is very unique wire. Tip load is 0.6 gram, same as filter XTR, but size of the tip size is 0.0078. This case, was LED CTO. As you can see, proximal LED is totally occluded. This is spider view. We can see the distal LED a little bit. So this case also has some microchannel. In this kind of situation, tip injection using microcatheter is helpful. We can clearly see the distal part of the LED. This is LL cranial view. But if we take a look at this angio very carefully, the microchannel is this coarse. So very, very tortuous three-dimensionally. First of all, we selected the field XTR. However, this wire went into the false lumen. And finally, huge dissection was made. In this first session, we gave up, and we plan to do the second session. At the time, dissection was completely healed. And we used Wizard 78. We manipulate this wire very carefully. We gently rotate this wire, and finally, this wire can negotiate a very tortuous part. And this is the final result. Actually, this case was exceptional. In most of the case, field XTR is very helpful. But in some cases, we experience this kind of. And next step would be the Gaia family. Gaia is a very unique wire. It has very good torque ability. Tip load is 1.7 gram in Gaia first, 3.5 gram in Gaia second, and 4.5 gram in Gaia third. As you know, in Japan, Gaia Next is available. Tip load is 2 gram, 4 gram, 6 gram individually. And this wire has pre-shape, 1 millimeter pre-shape. And the very important thing is this wire, tip of this wire is tapered. Tip of this wire is not round. So penetration force is relatively strong. We should take care. In this LAD CTO case, I start with field XTR. However, this wire went into the false lumen. In this aerial view, tip of the wire is on the right side to the true lumen. So we quickly move to the Gaia from the filter XTR. The concept of this wire is not drilling. So it's a deflection. We just push a little bit without rotation. It means a deflection. And then we rotate a little bit. And then I push this wire as deflection. We repeat deflection and rotation. This is the concept of this wire. In this case, I aim to the left side in this aerial view. This is our cranial view. Very fortunately, this wire can get distal to lumen. So this is my conclusion. My first choice of the anti-grade wiring is field XTR, and in some limited cases, I use Wizard series. And second step is Gaia, but in my opinion, I should limit the Gaia usage when course is very clear. Except for this situation, we sometimes use Miracle Family and Ultimate Bros 3-gram. And the final step is Conquest Family. Thank you very much for your attention.
Dr. Asakura, it's a wonderful talk. Just actually, you told that you can have a tip injection. Which are the situations you can use a tip injection?
I'm sorry?
You did a tip injection to the microcatheter. For the first, when the wire was not crossing, you just did a tip injection.
Yes.
Which are the situations which we can use a tip injection? Tip injection is not a nice thing otherwise, you know.
Actually, this method has some risk of dissection, so we should take care. So I use this tip injection when I doubt the existence of the microchannel.
When you doubt a microchannel?
Yes.
Okay. So one question can be from the floor. Anybody can have a doubt or a question.
One question only?
Yeah.
Today you clearly introduced the XTR good candidate. So do you choose the XTR, always you choose the XTR as a first wire for CTO regions?
Almost, yes.
Almost, yes.
Mic to Dr. Goyal.
Most of the time, I don't create second curve.
Yeah,
I just use original.
That's
reshape.
important. Yeah.
No more questions. We'll go to the next talk. Thank you, Dr. Asakura.